Hey everybody, Dan here with Pain For You. Kind of look like a lumberjack today in the shirt and the hat. Kind of chuckling at myself. Today's topic is going to be stop scaring the crap out of yourself. Alright? So I'll get to that in a minute. It's a nice crisp day out here. Pretty chilly. Breathe in the fresh air. Exhale the indoor air. Breathe in the peace. Exhale the stress and the noise. Inhale the bravery. Exhale the fear. So stop scaring the crap out of yourself. All right. The whole point here is we've got a lot of information from the internet, from doctors, from practitioners, from friends, from family, from the media, from everywhere, saying we're frail, easily broken. Be careful, be careful, be careful. Don't do that. X, Y, and Z is going to happen to you. If you do that, you're going to have pain for the rest of your life. And yes, all of those things are very frightening. But I will tell you, if you've been following me for any length of time, you understand that there is this thing called the mind-body syndrome. TMS, as Dr. Sarno termed it. Psychophysiological pain disorder, distraction pain, neuroplastic pain. You understand that stuff. You've done the research. You've probably read the books. And if you haven't, go pick up a book by Dr. John Sarno. The Mind-Body Prescription is my favorite of his books, but anyone will do. But once you know that there is this thing called the mind-body syndrome, and this reason for the pain being created in the mind, in the brain, and not a broken body, it's up to you to make a decision to say, okay, I've done the assessments, I've connected the dots, this is what's going on with me, and therefore it is time to stop scaring the crap out of myself. Because if you keep on ruminating on those awful things that you read on the internet, or that the doctors told you, or the practitioners or pain management people told you, that's on you. Don't get me wrong. We have all of these fearful thoughts because of things that other people and other information sources have told us. But if you keep on repeating them over and over and over again, that's on you. And it's really important to make a decision that says, I understand what TMS is, and I've done the connecting of the dots, and I recognize that this mind-body syndrome is the reason for my symptoms and pain. And make a decision to say, I'm going to take all of that medical jargon, all of those medical diagnoses, all of those incidental findings on my imaging studies, and throw them the heck out. Because they don't serve you any longer. All they do, every time you revisit those and listen in your head to the conversation you had with that doctor 2 months ago, 2 years ago, 2 decades ago, that says you're broken, your body's messed up, you're gonna always hurt, you gotta evict those thoughts out of your head and stop visiting them, right? And it is so easy for people to go, well, I'm like 95% sure that it's TMS, but I got this 5% little niggling bugger that just won't leave me be. And, when the pain flares up, I automatically jump to, oh my God, it must be my body, right? Look for evidence. Start keeping an evidence journal. Anytime you've got some element of proof that it's TMS, write it down. Keep that evidence journal. If you want some ideas for proof, go to the ppdassociation.org/symptoms. And there's a lot of questions there that have to do with pain characteristics, how pain behaves. And those are opportunities for you to find evidence. And if you check off, if you answer the question yes on that assessment at the PPD Association, and you've experienced those things, that's hard evidence. Look, if you can take a walk without pain, but then you hurt later when you get back home, it's evidence. It's mind-body. It's created in the brain. Because if it were structural, it would have been hurting you every step of the way. And there's a million opportunities for that type of evidence, and don't just latch onto that one and say, damn, but I do hurt when I walk, so it must be structural. I didn't say that. My point is, look for evidence that your symptoms are TMS. Did your symptoms begin at a very tumultuous, stressful, very emotion-filled time of your life? If yes, that's evidence, right? Your body didn't just break down because of, a grandmother dying, right? The brain created these things to distract us. I like Alan Gordon's phrase that these are just the brain interpreting normal sensations as dangerous. So it's a false alarm. It's the fire alarm going off, but there is no fire. So my encouragement for you is to notice and become aware of when you're ruminating on these scary, dark, I'm broken type of thoughts, and my life in the future is going to suck because I'm broken thoughts. And grab yourself by the shirt and say, stop. Stop scaring the crap out of yourself. It's not helping. It's keeping you in fear. And what do I always say? Fear is the fuel for these chronic symptoms, right? Fear and attention are what fuels and keeps these symptoms persistent. So if you don't want to have fear, you got to stop revisiting all that old incorrect information that you've heard about the reason for your symptoms or pain. They're not relevant. You now know what TMS is and have connected the dots and decided, right? You have decided, haven't you? You've decided that TMS is what is going on with me, this mind-body syndrome. And now that you've decided that, you've got to decide to become more aware of when you're ruminating on those scary, dark, fearful, structural, physical reason for the pain, and evict those thoughts. Kick them out. They don't belong. Stay focused on the solution. The solution is the stuff that I review all the time. So, listen. Please stop scaring the crap out of yourself. The doctors may have been the one to do that initially, but you don't have to believe what they said, especially now that you have new and more accurate information called TMS. So it's time for you to decide which one of the theories for the reason of your pain you're going to buy into. And if you're hanging on to the scary, dark, you're broken concepts, long after you've heard about TMS and found out what TMS is, that's on you. Right? You can't blame your doctor if you now know about TMS and you're deciding to discard all the evidence that proves that you've got TMS. Take the pain test, yourpaintest.com. Anything over 29 is evidence that it's TMS. And so you can get better. You will get better if you decide to stop revisiting all of those horrible, fearful, I'm broken thoughts and just focus on teaching your brain that you're actually okay already. So, it's a cold day. My hand is freezing. I'm going to wander back inside. And guess we'll see you guys tomorrow. Love you.